Health Nuts, episode 39.
You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and today I have on a special guest for you, and that is Dr. Rich Petras. Dr. Rich and his wife of 46 years have been owners of a natural supplement business for close to 30 years in Fairmont, West Virginia. In addition, he was a teacher and public school administrator for 35 years. A few years ago, he basically retired from both professions, occasionally as a substitute teacher, teaching while working with a few formal clients from their business. However, next to his faith and his family, teaching and helping people get well is his passion. He has a ton of education with degrees from Fairmont State University, West Virginia University, as well as Trinity School of Natural Health. It's a blessing to have him on. I'm looking forward to hearing his message. Today, we're going to be talking about overcoming cellular stress naturally. He's going to go into the nuts and bolts on what that means and how you can overcome it. So with that being said, Dr. Rich, welcome, my friend. Good to have you on.
Hey, it's really, really good to be here. It's an honor and a privilege. And wow, isn't this exciting times? Thank you for allowing me to be here.
Yeah, it's going to be a great episode, and you have a lot of knowledge to share. I'm looking forward to hearing your message today. That was a real formal intro of you. Tell the audience a little bit more about yourself. Well,
what you said is true. I spent a long time in the classroom teaching, and I also spent a lot of time as an administrator overseeing the education process in fairly large schools, always trying to get students, teachers, parents, everybody that I was responsible for to be the best that they could be as successful as they could be. But as far as the healthcare practice is concerned, wow, which one is more important? I don't know. People want to live healthy. They want to avoid disease. They want to add years to their life. And that's a big responsibility to help people to get where they want to go and get them to be able to reach their goals.
Yeah, I think you summed it up well with having the responsibility. One of the things I love about your background is you've been serving your entire life. You've been serving for your professional life and serving kids for all these years, been serving your patients for all those years, and having the empathy to do what you do for all these years. I know you've been able to change a lot of lives.
Well, that is true, and it is rewarding. And a lot of times, Dr. Carr, people will say, well, it's because of you that I am where I am. And if it was a student, I would say, no, you had to agree to implement those changes in your life. You had to make some changes, and now you're successful. You don't get in trouble anymore. You get good grades. Everybody cares for you. You're successful. And it's the same in medicine. It's not me, it's them. They have to choose to make changes in their lifestyle and what they're putting into their body. And when you do that, the cells of the body respond, and people do much, much better. And sometimes in the past, anyhow, it was more difficult to get a person well, but now we can help everybody. And that's why I came out of retirement.
Yeah, so I'm really looking forward to hearing this message as well. Before we get into this, in regard to overcoming the cellular stress, a quote, maybe words of wisdom. What's something you have to share with the audience?
Wow. Well, I'll tell you, there are two things. When I was in the classroom working with kids, I would use the technique of having them look into the mirror. Focus that. Go home and look at that handsome guy or that pretty girl that's looking back at you and know that that's you, and you're responsible for making good decisions for yourself, and make sure that you are responsible to that person, and so that you can be successful. And secondly, whether it's in school or whether it's anybody else in the medical realm, I would just share with people, look, if you want to be successful and you want your life to go well, just treat people like you want to be treated, and watch and see what occurs in a very positive realm. And that's what I would share with individuals, because I know over all these years, those two characteristics, those two messages, they are needed, and they work when applied.
Yeah, I love that. And it's pretty much, pay it forward, do unto others as you want to be treated. It's something we were talking about pre-interview, and it's something my father taught me for years and years and years, is that, treat everyone as if they're your own family, treat everybody with respect, and it's going to come back to you tenfold. So I love that message. This topic, though, why we can get into it, in regard to overcoming cellular stress, I've talked about overcoming stress naturally. Talk to the audience about what cellular stress is and why it's important to them. Okay.
Ready to go with that. Our bodies are made up of trillions of cells, and they make up 8 functioning systems of the body. And how our cells function is how we are going to how we are going to live our life, whether it's with a lack of health or we're really, really, really healthy and without pain or with pain, etc. But here's the issue. We do live or die at the cellular level, but those cells, and I'm using a medical term, by transcription, that nucleus has to be told, okay, you have issues going on, you have a need. And, the one thing that makes us all the same is we're different, and we're all different. So those cells need to be taken care of. When we reach the age of 30, we have a problem. We have enzymes that are, when we're born, or when we get to the point in our life when we're 30, medical research proves that these 4 antioxidative enzymes, glutathione, superoxide dismutase, catalase, and hemioxygenase, they diminish in production. Well, those enzymes neutralize 1 million free radicals per second, 24 hours a day. Medically, all disease is caused by free radical damage. Or when we get to a plateau where we can't neutralize them anymore and the free radicals win, then that's called age-related oxidative stress. Well, age-related oxidative stress, when we reach that point in our life, then we are going to start aging, and the disease is going to start manifesting, and the longer we go, the more the onset of those two things that will occur, and we've got issues. So we've got to be treated by prescription medication and surgeries and injections, etc. But we now know that there is a way to turn back the clock and get those cells to function, whether you're 20, 40, 60, 80, or older, and it's research validated that we know that in 30 days, by taking a formulation that has 45 years of medical research and validation, that we can turn back the clock and get those enzymes to be produced like they were 20 again. And as a matter of fact, the research states that in 30 days, a person will have eliminated 40% of the free radical damage or age-related oxidative stress. Well, when that occurs, then the damage from the free radicals stops in all of the trillions of cells. And number 2, the repair starts to occur. The research also validates that in 120 days, a person will then have eliminated 70% of the free radical damage. Well, the medical doctors on the calls that I attend on a regular basis simply state to the people that are listening in, well, what's going to happen if you eliminate 70 to 80% of the cause of whatever malady you're suffering from, whatever chronic condition you're suffering from? And the responses are simple. It's just, we're going to start to feel better, or we're not going to have pain, or our symptoms are going to start to go away. And that's exactly what the research purports and validates. And the exciting thing now is all the supplements that we used to provide for people to get the cells to work correctly and to try to overcome cellular stress, we don't have to use all of those anymore. We just use one tablet, which is very inexpensive, and it causes the cells to do what they are supposed to do and to function the way that they did when they were anywhere from birth to 20 years of age, when they were healthy and not aging. And it's the reason that my wife and I came out of retirement. One thing that is medically validated to work for everybody and neutralize or diminish the cause of every malady that they go to the doctor for to be treated for with meds or surgery or worse. So it is just the most exciting time in my career to be able to work with a person, knowing, and that adage that we talked about earlier, the one thing that makes us all the same is we're all different. Well, everybody's cellular need is different. So if you use a prescription or a supplement, is it, and it sends a message to the cells, is it overstimulating the cells? Is it understimulating? Is it not working at all? Is it something we have to metabolize and get rid of? The great thing about what we're doing now, Dr. Carr, is that the cells know exactly what they need to do for that individual. And when the nucleus of all the cells receive the message to do their job, and those enzymes are produced at youthful levels, the damage stops, and the repair or the need that is necessary to be taken care of for a person to live healthy or to delay or overcome those problems that they're going through, and research validated to add at least 3 to 5 years to a person's life, that process begins immediately. And the formulator of this product is a research scientist, most renowned medically in the world. Basically states at his lectures, no one is exclusive. It works for everybody, and the longer you take it, the better that the cells will perform. We have seen miracles. 84-year-old people calling back and saying, I feel like I'm 40 again. I can walk. I can get up without pain. I can do what I normally could do when I was younger. Well, that's what the research validates. That's what we're seeing every day. My wife and I have our own testimonies. I had sciatica really bad. Medical doctors couldn't solve it. My chiropractor couldn't solve it. 3 weeks on this formulation, it was gone. My wife had a situation in her left side where it was probably pancreatitis. It was chronic. In 2 weeks, it was gone for her. But believe it or not, the reason that we got into this business was because of our dog, Gracie. She developed lipomas. Vets cannot get rid of lipomas. They have to surgically remove them, and they always come back. Well, it's 4 months later, and she's been on the pet formula from our company that emanated from the doctor's 45 years of research on the human formula, and her lipomas are almost gone. As a matter of fact, went to the vet yesterday, and she sat down prior to surgery and said, I want to know how you did that. I want to be able to utilize it with our dogs. We can't do that. Well, we now have the means for either dogs or humans to show them how to stay well, how to get as far as wellness is concerned. Everybody is looking for that silver bullet. We now have it, and it's very inexpensive, and it works quickly, and it works for everyone. And we have the same advantage or the same opportunity for the owners of our precious dogs, our family members, to experience the same results. It is just the absolute most exciting thing we have ever done. Simple, easy, inexpensive, non-toxic, doesn't interfere with any of the medications that people are already on. And I will tell you that it is reported to us over and over and over again that people do not like to take their prescription medications because of the side effects. And many people are able to make a family, logical, excellent choice relative to their health. And many people are getting off of many of their medications and living very, very, very youthful, healthy, active lives that they weren't able to live prior to that. Hope for individuals when were told they didn't have any. And we're just passing that information on to individuals. And those people who experience the benefit are doing it. They want everyone to know. Because why? Everybody wants to live healthy. Everybody does want to delay disease or avoid it or overcome problems if they have them. We now research-based know that we can do that. But we also know that it adds to longevity. It is an anti-aging formula that will add at least 3 to 5 years to a person's life. And in the words of the research scientist that formulated it, the earlier you start to take it, the more productive years you can add. So is it possible to live to 100, 105, 110? The research proves it.
The couple questions to go back a little bit, 'cause the audience, there's a couple terms that I would like you to get defined for them so that they know more what you're talking about. Free radicals, I know what they are and how the damage is, but in regard to the audience, they may not know exactly what a free radical is, how they come about, why they so bad, and why they cause so many problems for people.
Well, I mean, if we breathe, we're going to experience free radical damage. I mean, it's oxidation. It's like rust on a car. It's the bad part of owning a vehicle, because over years, the structure of the metal breaks down because of oxidation. The same thing happens in our cells. A free radical is an unpaired molecule, and they want to be normal, so they go through the body looking for another molecule, and they'll rip a molecule from that to make a pair. So it's causing constant damage to all types of tissue throughout the body. And if we could stop that from occurring and keep them paired and neutralized, then people wouldn't have their issues. And that's what we have available. We can stop that process of unpaired molecules, make them normal so that they don't go through the body and cause scar tissue and cause damage and cause inflammation. When they're neutralized, things are good. When they're not, it's a free radical.
What are some things that maybe a layperson might be doing in their daily lifestyle that's producing oxidative stress or free radical damage in their body?
Okay, if we breathe, we're going to have oxidative stress. Right. But believe it or not, as good as exercise is, it causes oxidative stress. If we eat the wrong things, if we drink the wrong things, too much alcohol consumption. One of the biggest causes of oxidative stress is smoking cigarettes, taking drugs that are not supposed to be, non-prescription medications. People become addicted using things that are not good for them. And we know that research also shows that this formula breaks the addictive chain. So it's something that if a person has that issue in their family, they need to contact us, because we can show them a way to break that cycle. But at any rate, just living causes oxidative stress. But the better we live and the more healthy that we live, the less that we have. But we can't stop it. And it's medically proven that at age 30, we start minimizing the production of those 4 youth enzymes, which neutralize the free radicals. So is this an antioxidant? No. It simply causes the cells to produce those antioxidants like we were young again. And that's a great, great advantage to wellness and overcoming issues that they're going through.
A lot of people who come to my office, I do a ton of nutrition counseling, and a lot of these folks, they do various cleanses or detoxes, and with the hopes of detoxing at a cellular level. And one of the things that when people just go into just diet and they never are able to clean out their cell at the cellular level, usually 6, 12, 18 months later, is that they yo-yo that weight right back on because the cells were never cleaned out, if you will. Doing things like you're mentioning with clean nutrition, exercising, that still all has to play a role in overall health. We can't just be taking a magic pill and hoping we can still continue to live an unhealthy lifestyle. Would you agree?
Exactly. I certainly agree. And So eating correctly and watching what you eat and drink is very important. Getting exercise is very important. Getting normal sleep is important. Drinking water is the body is made up of believe it or not, the body's 75% water, and the cells need water also. So half your body weight in ounces of good water, there's a lot of it out there, is extremely important.
What's your definition of good water?
Pardon me?
What do you mean by good water?
Well, we used to own a company called Microwater Plus, so we were proponents of alkaline ionized water. It is important to alkalize the body. We are not proponents of distilled water because there's no life in it. There's no minerals in it. It's very acidic. It's contrary to the proper function of the cells. So there's good bottled water out there. There's good purifiers out there. We still are proponents of purifying the water and making it alkaline. But I do want to go back to something that you said. The cleanses are important, whether it be bowel cleanses or liver cleanses or yeast cleanses or parasite cleanses. Oh my God, as a naturopath, we did that so much in our careers, and all the reports that came back, you know exactly what I'm talking about. However, the medical validation of this formula, and the research is based on taking 1 tablet a day. The research is extensive. I mean, there's 29 peer reviews and there's clinical studies and et cetera, et cetera. But we know the research validates that this formula causes the cells to cleanse heavy metals, toxic substances that are in the cells that have been there a long time, like a person who's been in Vietnam and were subjected to Agent Orange, and that's in the fatty cells of the body. It's lodged there, it doesn't come out. It comes out. It causes the cells to rid the body of the things that you're talking about, that we cause our patients to understand that you've got to get these out of the body. If you want to be healthy, you can't sustain good health with those toxic substances lodged in the cells. Well, a person could go through a minor bowel cleanse. And so those things that are contrary to health, this formula, without taking tons and tons and tons of other types of cleanses, will cause the cells to cleanse as long as they're drinking adequate amounts of water for their body weight.
I love the information that you're sharing, but personally, within your own lifestyle, what are some things maybe you're doing day to day throughout, something you've done throughout the years to maintain your overall health? 3 things that maybe make you a health nut, if you will.
Well, great question. I mean, I'm 68 years old. I weigh 155 pounds. I've never had surgery. I'm not on any medication. So we have lived this route of eating the right things and drinking water and exercising and trying to minimize stress and getting the proper amount of rest, etc. But we were proponents of lots of supplementation. And I now know, Dr. Carr, that I could have been doing maybe as much harm as I was doing good, because what if it wasn't the right one supplement? What if it was too much? What if it was not enough? So we just continue to live that lifestyle. We drink water. We enjoy each other. We play golf. We are retired, sort of. This type of retirement here. We're very busy on national calls and with patients and people calling in, but we're still drinking the water. We're still exercising. We're still doing all the things. We're practicing what we've taught all of those years, but now we've implemented this company's formulation and the doctor's formulation that's backed by all this research. And we know firsthand with our dog, with myself and my wife and all of the patients that we're introducing this to, that it works. And so that's the change. We're continuing everything that we always did and everything we always taught. But now we've included this simple method of getting our cells to function correctly. I mean, the research purports that if you take this just for 30 days and you take the blood work of an 80-year-old man or a woman and you take the blood work of a healthy 20-year-old and do a T-bar test to check for the incidence of disease, you're not going to be able to differentiate between the blood of the 80-year-old and the blood of the 20-year-old. That's exciting. I mean, that's what people want. People want to live healthy. They don't want to get sick, and they want to live as long as they possibly can. And we now have the means to show them how to do that, and it's very, very easy and inexpensive.
If you're able to go back 35 years before you started your career, what would you tell, or maybe some words of wisdom you'd tell your younger self?
Oh boy, wouldn't that be wonderful to be able to do that? Wow. Well, I certainly would do some things differently for sure. Well, that's an interesting question, Dr. Carr, because the reason that we got into this business was, as a young principal years back before we got into the healthcare business and I got my degree as a naturopath, we were still trying to live healthy and do the things that were necessary to be as healthy as we could. But being a principal, a public school administrator, is a stressful job. And so there were some things that I was going through as a young person that I wanted to overcome. So that's where we started looking into the alternative measures that a person could do to stay healthy and overcome what they were going through. What would I tell myself? Well, this wasn't available then. This formulation wasn't available to the public then, so I couldn't take it. But I would just try to tell people, look, educate yourself. If I could do what I did and my wife did when we were younger, and dig into the research like we did with this formulation. I mean, it's so extensive, and there's lots of research out there on what to eat and what to drink and what the research says it's good for a person to do to try to minimize problems and stay healthy. I don't know that I would do a lot different because I think we made the right choice back then and looking at alternative measures. But, I have relatives who are a little bit older than me that are not healthy, and they didn't choose to go down the road that we went down. We know it works. Yeah. So I think we would probably do much of the same, maybe a little bit more aggressive in doing what we chose to do.
Yeah, I love the congruency in your lifestyle because you're talking to the talk, but you've been walking the walk as well. With the number of patients that I've seen you have through your years, I'm having a hard time now even seeing when I first meet patients that are in their early 50s, late 40s, without them being on a single medication or have had a single surgery. So to be where you're at, obviously you're doing something right. So to the audience out there, these are words of wisdom, but obviously it's been working.
Well, we to give one example of a person that came to us just a couple months ago, maybe 2.5 months ago, and he was referred to us by his brother, and he had a multitude of problems. I mean, really serious problems. He had diabetic neuropathy, obviously he had diabetes, he had COPD, couldn't walk up a flight of steps without stopping 5 times. He was in tremendous pain. He was overweight. We could go on and on and on and on. Well, we introduced him to this formulation, and he went and watched 2 simple videos and spent 16 minutes and called back and said, Dr. Rich, I'm on 19 medications. He said, they don't make me feel good. He said, they interact. He said, but I can't walk. He said, I'm 58 years old. And he said, I may as well be 90. He said, I just can't function. Well, in 2.5 weeks, the neuropathy in his legs was gone. He could walk up a flight of steps without taking a breath, leading a much more normal life. And today, 3 months later, he's only on 2 medications for his diabetes. Okay, so take the diabetic medication until the cells of the body repair everything that's necessary, and that situation is normalized. I mean, is he happy? Yeah. Well, I just said to him, you're not exclusive. It's going to work for you. The research proves it. Mm-hmm. That is exciting.
To the audience who's trying to find you, and now they've heard the information, they want to, possibly find out more about you, and they have more questions for you. How would somebody go about finding you?
Well, they can either contact myself my cell phone is 304-612-6186. Our business line in the office here is 304-534-5490. Or they could contact our business partner and colleague, and she's in the Pittsburgh area, Dr. Sandy Kuglix. She is also a naturopath, and her phone number is 724-622-8173. Contacting either one of us is going to be the same thing. They will get the same information. They can three-way with both of us, whatever, but it's just important to get that basic information out to them that I received myself. How did I find out about this? I went and watched 2 videos for 16 minutes, and then I became unglued, Dr. Carr. I had to know more. I started doing research. I jumped into all the evidence, and so did Dr. Kuglix. We are both very excited because we now have a simplistic approach that we can activate the cells of our body to do what they're supposed to do versus supplementing and hope that we get the job done.
And to the audience out there, the contact info will be in the show notes, so you'll be able to, if you missed any of the contact, it will be in the show notes. Just click on the link, and it will take you right there. Dr. Rich, appreciate you having on today's podcast. Thank you so much for sharing your message.
It was an absolute pleasure to be on today. Thank you for the opportunity, and we just want to continue to show people how to live healthy, how to delay disease, and how to add years to their life. And we now have the simple, medically validated means to do that. Contact us. We'll show you how to do it.
Check them out. And to the audience out there, thank you as always for being loyal listeners. Our tribe is building by each and every podcast, and I don't take you for granted, and I hope you're enjoying all the information you've been given over the years. Have a great week, and I look forward to talking to you soon. Bye now.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.